There are around 10,500 pancreatic cancer cases in the UK, which equates to 29 new diagnoses every day. The cancer is only getting more common and is predicted to rise by 6% to 21 cases per 100,000 by 2035. The main worry with pancreatic cancer is the survival rate, so catching pancreatic cancer early is important in your chances of living as long a life as possible. Express. Co.uk reveals the top 9 signs you have pancreatic cancer, according to Cancer Research UK. Pancreatic cancer isn't the most common cancer, but it's among the top 5 most deadly types. Pancreatic cancer has the lowest survival rate of all common cancers, with 5-year survival less than 7%. The sooner you catch the disease, the better your chances of survival. Unfortunately, pancreatic cancer doesn't usually cause obvious symptoms in the early stages, and the symptoms depend on where the cancer is in the pancreas. As cancer grows, it can start to cause symptoms, so it's very important to know the signs of pancreatic cancer. Pain in stomach or back. Almost 7 out of 10 people, 70%, with pancreatic cancer go to their doctors because they have pain. Pain is more common in cancers of the body and tail of the pancreas. According to Cancer Research UK, people describe it as a dull pain that feels as if it is boring into you. The site explains, it can begin in the stomach area and spread around to the back. The pain is worse when you lie down and is better if you sit forward. It can be worse after meals. Some people may only have back pain. This is often felt in the middle of the back, and is persistent. Jaundice. Many people with pancreatic cancer have jaundice when they first go to their doctors, although most of them will have pain as well. Around 1 in 10 people have painless jaundice, so watch out for yellowing of the skin and whites of the eyes. On top of that, Cancer Research points out, the wee, urine, is darker than normal, and poo, stools or bowel motions, may be lighter in color. Jaundice is more common with cancer of the head of the pancreas because the tumor blocks the bile duct. This tube carries bile into the small bowel, duodenum. If it is blocked, the bile ends up in your bloodstream and you pass it out in your urine rather than through the bowel. Bile contains a lot of yellow pigments, so it turns the skin yellow. Focus more on the eye symptoms related to jaundice, as jaundice is a common symptom of many liver and gallbladder diseases. You might also have itching if you have bad jaundice, as the increased bile salts in the bloodstream cause itching in the skin. Weight loss. Have you lost a lot of weight recently? At least 10% of your total body weight for no apparent reason? This symptom is more common in cancers of the head of the pancreas, and cancer of the pancreas can cause other signs or symptoms. These might happen before the cancer is diagnosed, or might happen later, or simply because not everyone has every symptom. Diabetes. Some people diagnosed with cancer of the pancreas are found to be newly diabetic, or some have been diagnosed with diabetes within the previous year. Diabetes means you're not producing enough insulin and therefore there's too much sugar in your blood. The sugar passes out of the body in the urine and takes some water with it, causing thirst, lots of urine, weakness, weight loss and hunger. Sickness. You may feel or be sick because you have jaundice or an inflamed pancreas associated with pancreatic cancer, as these conditions upset the delicate chemical balance of the body. Cancer Research UK points out, you might also be sick if cancer, or inflammation around it, starts to block food from passing out of the stomach and into the first part of the bowel. Due to sickness, you might have a loss of appetite which can cause weight loss. Bowel changes. If your pancreatic duct blocks, you might develop a symptom called steatorrhea which leads to fatty stools. The expert advice reads, you may pass frequent, large bowel motions that are pale-colored and smelly, and are difficult to flush away. These bowel disturbances can mean that you are not absorbing your food properly, and this can also cause weight loss. Fever and shivering. You might have a temperature from time to time because you have jaundice or an inflamed pancreas, the Cancer Research UK site says. When your temperature is high you may feel cold and shivery, but make sure this temperature is not a result of cold, flu or COVID before you panic. Indigestion. Indigestion causes heartburn, bloating and sickness. This is a common problem in the general population and normally nothing to worry about. However, if it is persistent or isn't getting better with medicines, you should go back to see your doctor. Blood clots. Occasionally, pancreatic cancer is linked to blood clots. The site explains, they may form in the deep veins in the legs for example, or in smaller veins anywhere on the body. Sometimes the clots will disappear and then develop somewhere else in the body. See your doctor straight away if you have pain, redness and swelling around the area where the clot is, and the area around the clot might feel warm to the touch.